Okay, go ahead, Chris.
Great, thank you so much, Shana. Good afternoon to you all. My name is Christopher Phillips. My pronouns are he, him, and his, and I'm an attorney here at the Center for Elder Law and Justice. I'm so happy to be joining you all via Facebook Live to have a little conversation about ways that we can leverage health insurance to achieve health equity for LGBT people. Just a couple rules of thumb. If you'd like to ask a question at all during this presentation, you can feel free to drop that into the comment section of this post, this Facebook Live post. Just note that after this live presentation has concluded for today, that section won't be monitored. So if you have questions beyond that, you can feel free to just give us a call or visit our website with the contact information at the end. But otherwise, during the live portion of this presentation, please feel free to ask any questions that might arise. So briefly before I get going, I just wanted to let everyone know that this presentation is part of a sort of larger initiative through the Center for Elder Law and Justice, known as the Silver Pride Partnership. Sort of this new initiative of providing some culturally competent civil legal services to LGBTQ folks ages 50 years young and above that meet some income eligibility criteria that you can see here on the screen. This is a new and exciting program that we are rolling out, and that's why you'll see that this presentation does have some specifically tailored material to LGBT folks, but I hope that you can see some general and more universal lessons from this presentation that can affect really everyone as well. But for more information on this project, please feel free to give us a call. We'd be happy to discuss that with you. So today, the main topic I want to focus on is that of health equity. And a way of describing health equity that I really enjoy, put forth by the Centers for Disease Control and Prevention, is a pretty simple sentence. It's just that health equity is when everyone has the opportunity to be as healthy as possible. It's a lovely sentiment. It sounds pretty attainable and pretty straightforward, but as we'll see throughout this presentation, it's not necessarily a given, and there are ways that we can perhaps do better in terms of health equity. The concept of health equity, though, is good to think about in terms of the concept of equity itself. This is a cartoon that many of you may have seen in the past or some variation, and it really gets to the root of what the concept of equity is. Equity is different from equality in that equity recognizes that there are certain individuals, certain communities that have historically faced some sort of deficit, some sort of disparity that should be recognized, should be corrected, and should go towards helping ensure everyone has an equal opportunity. This is a bit different from equality in sort of a level playing field. It recognizes that there are certain groups who, for some reason or another, have faced difficulties in the past, and perhaps could use some assistance to bridge the gap and solve those disparities. In terms of how we measure health equity and identifying places where there are certain inequities or disparities, we can look to a number of factors as outlined here. So we can look to things such as length of life, quality of life, rates of disease, rates of death, severity of diseases, access to treatment, and incidences of disability. So really these can help measure the concept of health equity. It can, if a particular group, a particular individual has some sort of deficit, there is some disparity, some inequity in one of these categories, it can help show a larger issue that needs to be addressed for a particular community. If there is a higher incidence of a particular disease or lack of access to a particular form of treatment for some section of the population, it's a good way of identifying what needs to be done and help to contribute to the overall health equity of all individuals. To answer the question of sort of what causes these health inequities, I'd like to turn to the concept of a social determinant of health. This is sort of a complicated term or phrase, but it's a pretty simple concept. So a social determinant of health is basically some sort of condition in the places where people work, where they live, where they learn, and where they play that affect their overall quality of life and health. There's a number of key areas that go ahead and directly impact someone's overall well-being and health, including some of the following: healthcare access and quality, education access and quality, social and community context, economic stability, and neighborhood and their built environment, an individual's built environment. All of these in one way or another affect the livelihood of individuals, affect their overall health as well. And so those sort of are the root causes of health inequities. If there is some deficit, some disparity in one of these areas, then there's generally going to be some sort of adverse consequence in terms of an individual's health. But today, really what I want to focus on is this first one, because it's sort of the most direct link to living a healthy life, and that is healthcare access and quality. Again, this is sort of the most direct and route between access to healthcare and then overall well-being. If individuals are able to access the healthcare that they need, they of course are going to live presumably better and healthier lives. And really, in the United States, there are really two main ways of accessing the healthcare system. It's either you pay into the system, you pay for your care completely, or you have some sort of health insurance or policy to help you cover those costs, which can be quite expensive. And really, for the majority of Americans, health insurance is the primary way that individuals access the healthcare system. But that's assuming that they have access to some sort of health insurance or health insurance policy. And so this presentation is really going to focus on the issue of health insurance, how to not only get health insurance, but get the most out of health insurance to ensure that all individuals live healthy and happy lives. However, within the context of LGBT health, there are certain issues that are worthy of noting. The Office of Disease Prevention and Health Promotion, which is sort of a branch of the U.S. Department of Health and Human Services, has identified a number of health inequities or disparities that are experienced by the LGBT population in particular. And that's what you see on the left here. So LGBT folks are more likely to face issues such as homelessness, particularly seen in sort of lesbian, bisexual, and transgender youth. There's also more incidents of substance use and abuse. Some mental health challenges disproportionately affect those in the LGBT community. Suicide is also a large concern in this community, particularly those who are younger. Certain sexually transmitted diseases, HIV including, also, and a higher prevalence for all of these for transgender individuals. So really, the Office of Disease Prevention and Health Promotion is identifying these as health disparities. And it's rather unfortunate that these exist, but it is sort of the reality in which we are living, unfortunately. And then this sort of reality is sort of made more stark by the fact that LGBT folks generally are less likely to have some sort of health insurance and thereby less likely to access the healthcare system. There's this 2014 Gallup report, a little outdated at this point, but it does sort of compare LGBT versus non-LGBT insurance rates. And as you can see, the report finds that the rate of LGBT uninsured folks is around 17.6% compared to 13.2% non-LGBT uninsured. And so what this really translates to in reality is that 25% of the LGBT respondents reported some sort of struggle affording healthcare at some point in their life. And this was up from about 17% for non-LGBT folks. Again, this is a little older, this policy, this Gallup report, excuse me. But it does show that LGBT folks not only have experienced some health inequities, but also have had a difficulty accessing the treatment to help with some of these issues. And so then the big question here is why? Why is that? I mean, it's very unfortunate, but I would like to know why. And there are a number of issues that you can point to help describe why these two sort of paradigms exist for LGBT folks. And they're all sort of rooted in a long storied history of discrimination. This history of discrimination has then resulted in things such as higher levels of poverty, perhaps barriers to care through plan exclusions that are sort of discriminatory in nature, lack of medical providers who are LGBT affirming and accepting, and perhaps even difficulty accessing family health plans. You know, if LGBT folks are not legally married, or there is some sort of exclusion in those policies rooted in this discrimination. And so really the question then becomes, given all of these health disparities, what can we do to help increase health equity for LGBT folks? And this is not an easy solution. There's no easy answer per se. But here are some suggestions and things that I'm going to be discussing today to try and help bring this concept of health equity for LGBT folks. The first is by fostering awareness of the different types of health insurance and eligibility criteria. It's a complicated maze of programs and eligibility criteria that I hope to sort of bring together today and make a little less demystifying, a little less mystifying, excuse me. The second way is by increasing knowledge of appeals rights and advocacy tips in the event that you're not getting the best care or the best coverage that your plans hold. And then the third way is by seeking out culturally competent and LGBT affirming medical practitioners. And these are just some ways that we can help increase health equity for LGBT folks in this country and abroad. So at first, I'm going to be discussing the different types of health insurance programs and sort of the eligibility criteria for them, how you get onto these programs in the first place. And I'd like to take a little framework from one of my colleagues, Kelly Barrett-Sarama, the sort of 6 common ways that people get health insurance. I think this is a good way to think about how we can access the healthcare system and which option is best for you. So the first and perhaps one of the most common ways that individuals get health insurance is through their employer, or perhaps through their family's employer. So through a spouse, through a parent, or some other qualifying family member. This can maybe even translate to some coverage in retirement from your employer, if you're lucky. But then there's sort of other programs outside of the employer realm, including things such as Medicare, Medicaid, and then private or public plans under the marketplace to purchase. And I'm going to take each of these in turn, discussing generally what they entail, how to qualify for them, and other considerations relative to these programs. For these first 3, however, it's going to be very specific to the individual facts in your employment history. So, if you have questions about whether you are covered under your employer's or your family's employer plan, I think it's probably best to start with that human resource director or someone in human resources to discuss whether or not coverage is available through your employment. So for these first three, I'm not going to really dive deeply into that because I think it's very specific to your individual circumstances and plans that your employer might or might not offer. The first one that I'm going to start with is Medicare. So Medicare is a program that for the most part is for those older than 65 and up. So in order to be eligible for Medicare, you either have to be 65 and up, and you and or your spouse is eligible for some Social Security benefits. The criteria for this is really based on your work history. So it requires that you have been working and paying Social Security taxes for 10 years approximately, and that's 40 working quarters. If you have questions about whether or not you are eligible for that, you can, of course, speak to your employer or some other professional about that. But generally speaking, for individuals who have worked and paid the Social Security tax for the bulk of their life, upon age 65, become eligible for Medicare. It's important to note that there are some penalties for late enrollment for Medicare. So if you do turn age 65 and are eligible for Medicare and choose not to enroll in Medicare at that time, you may incur some penalties if you decide later on to enroll. And that's something to be aware of as you reach that retirement age. There are certain circumstances in which individuals under age 65 are able to access Medicare as well. And there's generally two different types, some other circumstances as well, but two main ones. The first is that you are entitled to Social Security disability benefits for 24 months. So it requires sort of having a permanent disability or a disability lasting longer than 12 months. Or you're diagnosed with certain enumerated illnesses, such as Lou Gehrig's disease or permanent kidney failure, sort of end-stage renal disease. But these are generally the two different types of Medicare beneficiaries, broken down by age. Within Medicare sort of comes the alphabet soup. So we have generally two different types of Medicare that most people look to have, and that is Medicare Part A, which is sort of this hospital insurance. So that covers inpatient hospital stays, some stays at some rehab facilities if it's required. And for this, most people don't pay a premium for this Medicare Part A, and you're automatically enrolled if you do meet the Medicare eligibility criteria. Because most people don't pay a premium here because there are circumstances in which, for example, you do not meet the Medicare eligibility criteria for some reason. Perhaps you don't have enough work credits or something like that. You have an option to purchase Medicare Part A, but then that does come with some premiums. Medicare Part B is sort of the medical insurance. So this covers things such as outpatient medical treatment, your doctor's visits, things like that, that perhaps you're more likely to need on a day-to-day basis at least. And this does have premiums attached to it. Individual standard premium for 2020 is around $144.60 per month, which can increase with your income. Then we have things called Medicare Advantage programs, sometimes called Medicare Part C, but really Medicare Advantage, which sort of combines these first two parts, the hospital insurance in Part A and the medical insurance in Part B. It's just a different way of administering these plans. And these premiums are going to vary by plan, so you can certainly look into that if you think that is an option. And then Medicare Part D is going to be prescription drug coverage. Again, these premiums will vary by plan. So the Medicare program, that's just some general high-level information about the different types of Medicare, how to qualify. For more information, really, Medicare.gov has some really wonderful resources that you can feel free to look at. It's also important to note that Medicare open enrollment is currently ongoing, started on October 15th and continues until December 7th. If you'd like to make changes to your Medicare policy, now is the time to do so. So that's sort of the first way that individuals access the healthcare system, access health insurance outside of the context of their employment. The second way is through Medicaid. And sort of maybe the best way of describing Medicaid is by looking at the individuals that Medicaid serves. So Medicaid.gov here states that Medicaid provides health coverage to millions of Americans, including eligible low-income adults, children, pregnant women, elderly adults, and people with disabilities. Medicaid generally falls into one of two different types of programs, so-called community Medicaid and sort of so-called long-term care Medicaid. Community Medicaid covers things sort of everyday doctor's visits, routine medical care, things like that, while folks are living in the community. Long-term care is more designed for those living in skilled nursing facilities to cover those costs, those monthly costs. There are certain look-back periods, which means that in order to be eligible for these programs, the state Medicaid programs will look into your finances for a specified number of months to see if any transfers were made to qualify, because we will see that there are certain income and resource limitations for these programs. Community Medicaid historically has not had a look-back period. However, they're effective October 1st, 2020, there is now a 30-month look-back period to look out for if you are applying for community Medicaid at this point. And for the long-term care Medicaid, there is a more lengthy look-back period of 60 months, so 5-year look-back period into your finances to see if things were done to move assets or income out of your name. These look-back periods, again, are related to the income limits that Medicaid, income and resource limits, excuse me, that Medicaid imposes. So as you can see here, it's a slide full of numbers, but for an individual, there's a monthly income limit of about $895 a month, and a limit in resources of $15,750. The difference between income and resources. So income is basically any money that comes in, whether that be through employment, through earnings, or through government benefits, or some other source of income that is coming into you. Resources are things such as your bank accounts, your assets, your property, but does generally exclude the home in which you live. Again, if you have questions about your individual eligibility and your financial picture, it's really important to consult with a professional to discuss your options and see if there's ways of you qualifying with what you have. For married couples, there are different figures depending on whether or not both married individuals are Medicaid or just one of them are. Again, if you have questions on your eligibility in your particular resource and income level, it's probably best to discuss this with a professional, whether that be an attorney or some sort of trained health insurance Medicaid specialist. But then the final option sort of to get health insurance is by going to the marketplace. So this was really what the Affordable Care Act really tried to do, is increase coverage to individuals who really did not qualify under any of these other health insurance programs. So the marketplace allows an individual to purchase health insurance, private or public. Again, if you're ineligible for other coverage through these programs that we've discussed, or perhaps it involves a lower cost, some cost savings. To find out more information about the marketplace, you can visit newyorkstateofhealth.ny.gov. It has some really great resources and allows you to put in your individual circumstances and determine what the best program is for you, or again, speaking with a professional to determine the best healthcare option for you, best health insurance option for you. And really, by accessing health insurance, we can then increase access to the healthcare system more generally. Then the second sort of suggestion that I opined in order to increase health equity for LGBT folks is increasing knowledge of an individual's appeals rights and some sort of tips for advocating under their plans. It's really important that you know your right to appeal. So say, for example, you receive some sort of medical treatment or procedure, and then you receive a bill stating that your health insurance won't cover it for a particular reason. It's important to know what sorts of things your health insurance do and do not cover. So really, you have to look into your plan description when deciding sort of what elective surgeries to get, what elective procedures to get, and what your health insurance will cover. But then, it's also important to know if you do receive such a bill, what your appeals rights are under that bill. So you can look to things such as your notice of non-coverage or some sort of denial, or again, a bill that usually will enumerate those appeals rights. And it may very well depend on what sorts of plans you have. So look again at your plan documents to see what your rights and options are moving forward. Once you know that, then you can conduct research on applicable rules and what sorts of things you have to do to overcome this notice of non-coverage or denial. And this very well may again be a place where you would like to consult with a professional, such as an attorney, to help you advocate and perhaps overturn that denial in some way. In the context of Medicare, I really like this graphic here. It's from the US Department of Health and Human Services. It shows generally that there are 5 different levels of an appeal for Medicare. So if something is not covered under Medicare for some reason, the first 2 levels are sort of similar. They involve reconsiderations or redeterminations by sort of independent contractor agencies that look at the record, look at the bills, look at the procedure, and determine whether or not coverage, whether Medicare should have covered this particular service or procedure. Then the third level is really where it starts to get into sort of the hearing context. The first 2 are sort of on paper with these independent contractors. The third level involves going in front of an administrative law judge, sort of an adversarial proceeding to discuss, and determine whether this particular service or bill should be covered under Medicare. If it's not resolved at this level, it will then go to level 4, which is the review by the Medicare Appeals Council. And then finally, if it is not resolved after this level, it'll then go to judicial review in front of a court of law in the United States District Court. Again, as you can see, it gets progressively more adversarial, so to speak, and perhaps more complicated depending on the issues. So really, if you're going to pursue this process, it might be prudent to speak with a lawyer or a professional about the best way of going about this. This is sort of a similar process in Medicaid. First, if you have a bill that is not covered under Medicaid, you first have to exhaust any internal review of that. So when you receive the notice of non-coverage or denial notice. You will have there your appeals rights, and you can then exhaust those before then requesting a fair hearing, again, in front of an administrative law judge, perhaps where you have an attorney or other advocate by your side, trying to fight for coverage under this case. But really, it's important throughout all of these processes that you know your appeals rights, and what to do when you do get hit with that bill. In terms of utilizing appeals to ensure LGBT health equity, it's important to know that appeals can be levied if there's some sort of discriminatory intent behind the denial, or some sort of reason. And this frequently comes up in the context of transgender health. Transgender health includes a number of different considerations, including appealing denials for things such as gender transition procedures and hormone therapy treatments, because these generally have specific requirements under plan descriptions. And so it's important to know that in the context of transgender health, appeals might be levied if there are certain conditions that are not met. And to this end, just keep an eye out on our on the Center for Elder Law and Justice's website and blogs. There's going to be a blog post that we're going to be rolling out shortly that discusses precisely this issue in terms of transgender health, how to really appeal denials for certain things such as gender transition procedures and hormone therapy treatments and things like that. So keep your eyes on the Facebook page and our website for that in the days and weeks to come. And then the final way really of ensuring health equity for LGBT folks is really seeking out culturally competent LGBT affirming medical practitioners. And again, this comes from within the healthcare profession itself. And there's no easy way to do this. I think there's making huge strides recently to do this. But really, that's another really important piece, is getting buy-in from the medical practitioners themselves. What's the best way to do this, you might ask? Well, one way is by word of mouth, right? So you can speak with individuals in your community and see, if they use a particular healthcare provider that they find welcoming. The Pride Center of Western New York is really a central hub and really wonderful resource for all LGBT folks in the Western New York community. And they really do have a finger on the pulse of culturally competent services and providers as well. So that's a great place to look. And I highly recommend connecting with them if you have questions about finding the best provider. If for some reason that does not work out, you can then consult Google. You can do a Google search for providers that are LGBT affirming and accepting. One resource here is the GLMA, Health Professionals Advancing LGBTQ Equality, formerly Gay and Lesbian Medical Association. They have a great directory on their website where you can input your information, your address, and they can spit out a list of sort of recognized medical professionals in your area who can provide some competent services for LGBT folks in particular. And to that end, that will be the end of this presentation. I will see if there's any questions. I don't see any here, which is perfectly fine. Here's our contact information, though. If you have questions about this presentation, it's a lot of information, and certainly health insurance and the issues surrounding insurance coverage can be very complicated. And so it's important really to speak with an individual about your particular circumstances. You can give us a call. Our main intake line is 853-3087, or otherwise feel free to visit our website, elderjusticeny.org. Thank you so much, and feel free to look out on our Facebook page for some other great presentations moving forward. Thank you all, and have a great day.